in Latin America. But the impact is a global one. So which is your recommendation as minimal monthly sequencing, for example, in the reality of Latin America today? Who should pay the bill because it's for everyone, the interest? And in a landscape of financial constraint, at what level should be prioritized because there is lack of money for all the necessities. And a second question, that is, which is your recommendation also for Latin America when a new variant of concern is detected for the first time? If there is any evidence of closing frontiers, and when I talk about frontiers, can be country frontiers, but also state or city, because there are many examples that the people is not allowed to go out of the city because a variant of concern.
Yeri podría contestar.
Set of questions, and there are many questions grouped in two groups, I would say. And as of first, Dr. Etienne provided all of us with a very comprehensive panorama and regarding how the genomic surveillance is important at this moment, at this time of a pandemic. I'd like to provide you with some more information, and also we'll try to address your concerns. As of 8 February, it means 2 days ago, 37 countries and territories in the Americas have published their genomes in a global platform which is called GS8. It's 113,000 genomes were published by these 37 countries, and it represents 20% of the global, the total of genomes published at global level. So this is important. The other aspect, repeating what Dr. Etienne said, the 3 variants of concern have been detected in 20 countries in the Americas. So the main goal of the regional network for genomic surveillance is to increase the geographic coverage of the surveillance, but also the number of samples that are sequenced among the many cases that are laboratory confirmed every week. This network, coordinated by PAHO, is accessible to all countries, but it's important to mention there are 2 groups. The first group is the countries that can do the sequencing themselves, and we have a set of recommendations for them. And the other group is the group of countries that can ship to one of the regional laboratories in Public Health Institute of Chile or Fiocruz Foundation in Brazil. It's important to mention that the US CDC is also assisting directly countries through its own country offices. So what PAHO is doing? PAHO is providing countries with, of course, technical guidance, but also with the reagents to do the sequencing and with the equipment for doing the sequencing. And it's also funding the shipment to regional reference laboratories. However, we are hopeful that the governments will assign more funding and fund both their own network when existing and their shipment, international shipment. But we remain available to the countries for assisting in these 2 aspects. Answering levels of priority. The first level of priority is really ensuring a coordination, integration of a national network within the countries. For example, including integrating academic institutions, work all of them, all the labs in the same line, I would say, for doing the sequencing. But also linking closely the epidemiological surveillance systems and the genomic surveillance system with clear triggers for increasing the rate of sequencing. For example, when the incidence in one specific territory of country changes by 50% in a short period. So regarding public health measures in a context of variant of concern, and we have 3 on the table at this moment, reported in 20 countries and territories of the Americas. PAHO is asking the national and the local authorities, as well as the public, to continue their efforts in curbing the transmission of COVID-19 in implementing strictly the public health measures. All countries, provinces, states have developed their own guidelines and battery of public health measures. It's now a matter of collective discipline in implementing strictly these public health measures. Regarding travel-related measures, international travel-related measures, we are recommending to countries to have a risk-based approach. However, we are aware that in some situations, as land borders, the implementation is very challenging. The example of the tree border area between Brazil, Peru, and Colombia has been mentioned previously by our director. These are challenging environments, and specific measures in trans-border coordination should be implemented. I hope I have answered your concern.